Our Place is about local people transforming services by working in partnership with community groups and statutory organisations in a neighbourhood. An Our Place partnership in Gateshead piloted a project to transform the service at St Albans Medical Practice. A community organisation, Edbert's House, worked with the medical practice to employ a full-time community link worker based within the surgery. The community link worker is there to listen to patients' non-medical issues, such as concerns about debt and social isolation. They refer and can accompany patients to activities in the community that can help with these issues. In this film, those involved will tell you more.
So we see on average about 14 patients in a session, and that's about 3 patients out of every 14 patients seen as a non-medical issue. The impact of the community link worker for St Albans Medical Group has been beneficial not only to the patients but also to the practitioners. The GPs, practitioners find it very difficult when a patient comes in with a non-medical issue and there's very little that you can do for them. We tend to find they just come back again and things are no further forward. So for the practitioners it's been fantastic because they've then got a solution and something to offer to a patient. The patients themselves have just been absolutely over the moon with it.
Folk were coming to the GP, they had non-medical needs, they were needs that the doctors couldn't meet. There were needs around debt, there were needs around housing. They were causing health problems because they were causing anxiety and stress, but they weren't actually issues that the GPs had the expertise or the capacity to meet. We also talked to local people who found that a lot of their stress and anxiety wasn't properly being met at the doctors because the doctor again didn't have the capacity to really look at the root causes of the lack of well-being that they were experiencing. So we could see straight away that actually to put a community link worker in, someone who could link someone to the services in the community that could help meet those wider needs would be something that would be really effective.
The Community Link project has been very easy to refer to. The worker is based in the practice and we see her on an almost daily basis. The system that we've devised for referrals is very straightforward and doesn't add to my workload. And our link worker is excellent at feeding back whether she feels we've referred appropriately and also the outcomes for the patients that we've referred to her.
My job is the community link worker. I'm based in St Albans Medical Practice and I receive referrals from the GP and the nurses here, and the way they do that is they send me a task on EMIS and then I make contact with the patient. Once I've done that, set up an appointment either at the GP practice or I visit them at home or somewhere in the community that's easy for them to get to, and then it's really informal kind of consultation, very patient-led, patient-centred, where we go through the issues they face and why they've gone to the doctor. And quite often what happens is, because there's no set time necessarily for that appointment, other issues that maybe haven't came out when they've been face to face with the GP or the nurse start to come out and you get a better idea of kind of what's going on in that person's life. And then we sit down together and we draw up a social prescribing plan of kind of the next steps that we're going to do, whether that might be booking appointments for people at the citizens' advice and sometimes going along with that person to the appointment, or taking them to places like Tyneside Women's Health, Edbert's House sessions. A lot of people want to be accompanied to sessions, they don't just want to be given a leaflet.
I had a patient who I've known for a very long time who, during the course of trying to engage him over his mental health issues, I realised that he had quite poor literacy. This wasn't something that we'd ever talked about before, and I did manage to get him to discuss it with me, and we talked about what we could do for that. In the past, when I've identified that with patients, I haven't known what to do or where to access support for them, and it's been difficult because I can't agree to write to them or send them things because I can't guarantee they would get that information. So having the community link worker has meant that I could refer that person for face-to-face or telephone support. They've been able to access a service to improve that person's literacy, and that person has gone on and accessed that service successfully.
Helped us get me benefits sorted, because I wouldn't even know how to start. It was very helpful for Deborah to come out just because I could talk over things with her, things I was worried about. And I've got a phone number, if I need to get in touch with her I can, which is helpful for me. And she's been very nice and helping us, and she understands the way I feel and everything.
That sense of joined up working has been really exciting, where the GP is able to look at the medical needs of the individual, and the community worker can look at how that individual can relate to the community, can build better, stronger social networks for themselves and build their own capacity so that they can manage their own health and their own condition much more effectively in the future.
It's helpful coming from a community background because it means that I've got a good knowledge of the services and organisations available in Gateshead. It also means that I'm coming to that appointment with the patient from a very different view from the doctor and the nurse. I'm looking at those kind of issues that are having an impact on their health, but that can't be treated through medical prescriptions.
We get an idea through the Community Linking Project of what the demand is. You know, what we've just recently put on some Tai Chi classes there for a lot of older people within East Gateshead, because simply nobody was doing that, and this has given us the intelligence to be able to sort of go to funders and say, look, there's a demand for this, can we put it on please? And that's all because of the Community Linking Project.
The partnership has been exciting because it's enabled us to pool expertise. So Ebberts has been supporting people in the community for over 5 years now, looking at issues around debt, looking at issues around capacity, helping people to really appreciate their value and worth. So we have a lot of expertise in that field. The GPs are obviously experts in the medical field, and so together, by jointly managing the community link worker, then we're able to meet people's needs in a holistic way, which is a really exciting thing to be able to do. Delivering the community linking project for 12 months has cost approximately £30,000. This includes salary, administrative costs, overheads and other expenses. However, after completing our cost-benefit analysis, it's clear that substantial sums can be saved. We've tried to be extremely conservative in our estimates, but if non-medical GP appointments are reduced by 150, there is a saving of £7,050 per year. And if 4 people per year can remain in their own homes, then £74,672 could be saved. And our cost-benefit analysis, which also modelled improved mental health and reduced drug prescribing, showed an overall financial return on investment of £1.61 for every £1 spent.
The project is starting to show a reduction in GP appointments. It's very early days, but some patients who were attending on a regular basis now have gone into other services and are being helped.
We're starting to get a lot of feedback from patients, and that feedback has been positive. We're starting to see how the service is having a real impact on people's lives and how it's making a difference to their health.
Having the community link service in the practice has made a real difference for us and our patients. It's reduced a lot of the GP frustration about not knowing what to do and what to suggest to people, and it's provided a really good source of support and advice for people with non-medical issues.
I met Deborah and she changed everything for her. She managed to get us a stair lift put in and all the amenities that I needed help with, and it's made life much easier for myself and my husband.
I'm saying I'm over the world with Deb. And I am, because I would have been lost.
If I hadn't been referred to the care worker, I really don't know where I was going to go. I actually felt very suicidal, and just by the care worker coming round, it was just fantastic, because there was no other help, you know, that I could go to or talk to. And I've told the care worker things that I've never spoke with anybody before, so that's been really good. Maybe because she's not family, I'm able to talk to her about a lot of things that's happened, so that's been really good for us, yeah.
Please go to mycommunity.org.uk to find out more.